From CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to Facing South Florida. I'm Jim DeFede. Earlier this month, the Miami-Dade County Commission voted to end the process of adding fluoride to the county's drinking water. Mayor Daniella Levine Cava then vetoed the measure, and in 2 weeks, the County Commission will have the opportunity to override that veto. Now, attacking the use of fluoride in drinking water has become a cause for those on the far right who have made it part of their ongoing campaign against science. It has been pushed by both Donald Trump and his HHS Secretary, Robert F. Kennedy Jr., and by Ron DeSantis and his Surgeon General, Dr. Joseph Ladapo, who showed up at the commission meeting to speak on behalf of the anti-fluoride bill.
So if you, as the leaders of this community, make the decision to continue adding fluoride to water here, you have to believe one of two things. You either have to believe that all of those studies, all of the researchers, all of that work is wrong, incorrect, that there are no harms, or you have to believe that you are comfortable potentially harming some people in your community. Some of that research is right, but you are comfortable adding something to the water that could potentially hurt some of the people in the community, particularly children and pregnant women.
To be clear, the majority of studies have found fluoride to be safe. Now, there are studies raising questions about the possibility that high levels of fluoride can have an adverse effect. Yes, there are those studies. However, those studies are far from conclusive, and many scientists have questioned their results. But what Ladapo is doing with fluoride is the same thing he does with vaccines: raise enough doubt to scare people and label it as prudence. This week, I spoke to Ron DeSantis' first Surgeon General, Dr. Scott Rivkees, who was sidelined by DeSantis for presenting the facts during the pandemic. He is now an Associate Dean at Brown University.
Where you have fluoride supplementation in the proper range, you decrease the levels of cavities that children have by about 50%. And the evidence is also pretty clear that it is very safe when it's used in proper levels. So in terms of the comment from the mayor, where she said that ending fluoridation would have real and lasting harm, especially for children and families who cannot afford regular dental care, that is absolutely spot on. And the other issue, which really goes hand in hand with this, is dental care and dental access. More than half of the children in Florida are on Medicaid. There's a real shortage of providers that will provide dental care for children who are on Medicaid and also for children who are not on Medicaid. If you are going to say we want to get it out, and there are some countries that don't have fluoride in the water, you have to provide reasonable alternatives in terms of what children will be able to do for the benefit of their dental health.
So the notion of removing fluoride or severely limiting fluoride at the same time, while you're not providing the dental services that children need, that's sort of like a double whammy against those kids, isn't it?
Yeah, absolutely. It's very much unfair to children. Again, information available out there show that you can reduce the number of cavities that children have substantially. But, Florida is really impacted by the shortage of dentists who will take care of children, and especially the number of dentists who will take care of children who are on Medicaid. So, if you're going to address this issue and you're going to say we're not going to have fluoride in the water, that we're going to accept children having more cavities as the new normal, we have to be able to provide preventative strategies and also additional treatment for these boys and girls whose teeth are going to suffer.
This gets to the larger issue, which you and I have spoken about over the years, which is the attack on science, the notion that scientists and studies can't be trusted. Talk a little bit about what you see, how that relates to this argument that we're having now.
Yeah, I mean, this is part of a bigger conversation that we are seeing now, where we're seeing politics and ideology replace fact and science. And we're seeing this spill over in many different areas. So, for example, let's look now. What's happening with measles in the United States? There are probably more than 1,000 cases of measles in the United States, 800 reported, but probably at least double or triple number of that cases which is not reported. We never had this before. The number of children who are being hospitalized for pertussis, also called whooping cough, is really very high, something that we have not seen before. And the reason that we are seeing this is because there is a movement afoot, basically trying to discredit vaccines and take away standard public health measures which happened to work before. So again, when we start replacing medical practices with politics and ideology, individuals are going to suffer.
As you've watched what's been occurring at HHS, what's your reaction to it?
Yeah, well, it's unfortunate that, first in terms of what Health and Human Services do through the Center for Disease Control, through the NIH, CDC works to keep us healthy. It protects us from infectious threats, protects us from other kinds of things, tobacco-related problems, mental health-related problems. Uh, in terms of what NIH does, NIH provides tremendous amount of research support, which leads to development of new cures, new therapeutics, and just basic understanding of science. And what we're seeing now is that a major philosophical shift so that CDC and NIH, a large part, many of the programs are now eviscerated. HIV is still a problem in the United States. Florida, in fact, typically will have the highest number of individuals diagnosed with HIV per year. So we've seen CDC programs related to HIV going away. CDC programs that focuses on asthma prevention going away. Tobacco control programs going away, worker safety programs going away. There's so many aspects that CDC did quietly behind the scenes, trying to keep us all healthy, programs which are now gone. And then in terms of the impact on scientific research in this country, right now, about $40 billion of CDC funding goes to support research laboratories all across this country, including Florida. And what is proposed is that this number will cut by a half, which is going to have broad impacts on our country's ability to lead science in the world and lead to new discoveries and cures.
I think through the DOGE cuts, they're planning on eliminating 20,000 positions at HHS, which would have a dramatic impact, obviously. But I do want to note, I do think HHS and the new secretary, Robert F. Kennedy Jr., is trying some good things. It's the scale of the bad that he's doing at the same time that is problematic. But for instance, this emphasis that he wants to do on keeping Americans healthier. And I know that I believe it was the FDA commissioner this week who also announced removing some dyes, red dye number 3, red dye number 4 from food products.
Yeah, so I think we have to separate sound bites from true action. It's great to say we want to keep America healthy and address chronic diseases. Chronic diseases are a huge burden on individuals. Heart disease, diabetes, obesity, lung disease. A lot of this really happens to do with access to health care. These are very complicated issues. We know that society, where we live, the environment around us influences our health. So how, on one hand, are you going to sit there and say that we want to fight chronic diseases, whereas on the other hand, the federal government is decimating the programs related to environmental safety and quality? We know that asthma and lung disease, that particulates in the air pollution are a factor. So we can't, on one hand, say that we want to decrease chronic lung disease. On the other hand, allow levels of pollution to be able to go up. We can't say we want to address obesity, other kinds of diseases. On the other hand, when we don't make access to health care for all of us free and freely available. So in practice and in theory, it's great. It really has to do what is going to be in the operations to allow us to continue to address these issues.
One last point about fluoride. The Florida legislature is also considering a statewide ban on fluoride. We'll keep you posted on that as well. When we come back, we'll continue the conversation about what Donald Trump and Robert F. Kennedy Jr. are doing to the Department of Health and Human Services. I'll speak to Donna Shalala, the HHS secretary, during the Clinton administration. Stay with us.